Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrsu Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrsu Webb. Glad you all could join us once again before our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, tuning in to our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. Well, I know a lot of you guys are getting out and about. You're planning your summer vacations, also doing your traveling for the holidays. With that in mind, though, you also have to remember, as you probably have been seeing on the news, COVID-19 cases and even hospitalizations have been creeping up in some places, including we've been seeing it in my home state as well. Well, what should you know as you're going out and about and traveling, as well as, of course, about the vaccine? I know a lot of you have gotten the vaccine. For some, though, you may think, well, you know, if I've already had COVID, what's the need? We're excited to welcome Dr. Jamie Wagner to our program today. Dr. Wagner is a clinical associate professor of pharmacy practice at the University of Mississippi School of Pharmacy. Dr. Wagner is going to help you guys see why the COVID vaccine is something you should be able to get, and also where you can get more information as well. Dr. Wagner, thank you so much for the time. Really appreciate it.
Yeah, thank you so much for having me, Cyrus.
Well, there's so much information out there, and we always are glad to be able to have a trusted source to be able to help us out. So I want to ask you this question, Dr. Wagner. Why is it important to get vaccinated instead of just thinking you can just get COVID and be done with it?
I think that's a really excellent question. I think that's a question that people have been asking themselves since the start of the pandemic. And I think what we've learned so far over the last 2 years is that COVID is still, unfortunately, very unpredictable. We don't know if somebody who gets infected is going to have a mild case. We don't know if they're going to have a severe case. And quite frankly, getting vaccinated actually helps prevent that severity from occurring, okay? So the unvaccinated people were twice as likely than those who were vaccinated to experience ongoing symptoms. And honestly, as an infectious disease specialist pharmacist, the long COVID is what scares me the most because we cannot do anything except mitigate the symptoms of that. And so if you get the vaccine, you are far less likely, if not going to get long COVID. And to me, that is well worth it to get that vaccine instead.
Dr. Wagner, I think, you know, for so many people, and I get it, I haven't been outside of Mississippi now in 2.5 years. Because of the pandemic, I haven't started traveling outside the state yet. But people are ready to get out and about. They want to be able to go about their lives. What could another COVID surge mean, though, for summer travel, as well as people feeling safe while they're traveling?
Yeah, that's a great question. And I totally understand not getting out of this state in 2.5 years. I've slowly started being able to travel and seeing kind of what that's like both within the U.S. and then outside of the U.S. I just got back from an international travel experience. And I know that a lot of people are starting to get out and about. They're going to the stores. They're, you know, trying to be back to normal, right? And I think the way to think about that is what can I do to keep not only myself safe, but what can I do to keep others safe around me? Because you don't know, does that person just have chemo the day before? Did this person just get, you know, their medication to help with their rheumatoid arthritis that puts them at risk for infection, you know? And so trying to think of not just myself, but others. And so vaccination, number one thing that you can do to try to protect everybody else. But I think the thing that unfortunately we don't like doing is masking and hand washing and trying to social distance with other people. And you can still do that safely. And that still allows you that ability to travel and to experience what we enjoyed before this pandemic even started. So again, if you're not vaccinated, get vaccinated. Otherwise, really masking, washing your hands, using the alcohol hand sanitizer, trying to keep your distance from others, especially indoors. That's the best thing to do. But, you know, if we have to get out, we have to get out, right? Like, we don't need to go stir crazy staying inside.
Exactly. Totally agree. You know, we've heard a lot about herd immunity, Dr. Wagner, or natural immunity, especially for those who have, you know, already, you know, been infected with COVID. Is that something, because people do wonder, is that something that we could rely on versus getting the vaccine, or why is natural immunity not something that's going to stop COVID?
That's a really great question. I mean, quite frankly, that's what we think about with a lot of other vaccines is, we, are able to have this many vaccinated, and so if anybody else gets it, they shouldn't because we can't spread it. And so thinking of it like that is, if you got COVID, I'm not going to spread it to somebody else, and that's just not true. You're still going to have another opportunity to get it again, especially as these variants keep changing. And so that's going to be a problem. And then getting COVID a second time, while uncommon in the first 90 days after that infection, it's really unclear how long that lasts. We do have data that say that the vaccines actually elicit a higher immune response, meaning you're more likely to be protected against that severe disease with COVID than if you were to rely on just that natural infection. And so, again, trying to highlight the fact of how important getting vaccinated is, not just for you, but for others in your community.
And you brought up the other variant. So for those of us who have already been vaccinated, can we rely on then the current vaccines to be effective against these new variants?
Great question. And that's something, honestly, that I've been looking into myself lately. So I've gotten 3 doses. So I've gotten my 2-dose series and then boosted one time. And I noticed, too, that, these variants just keep coming out and keep coming out. And so far, the data that we have says that, the vaccines will go ahead and provide protection still against them. There is some question about how strong of protection as these variants keep emerging. And I know that there are several other companies that are working on different variations of the vaccine to try to anticipate what the variants are going to be doing and try to get that next booster against the new variant. But in the meantime, still, the vaccines that we do have do offer that protection against severe disease with these new variants still.
Dr. Wagner, I did want to ask you this. I mean, as we are kind of thinking about COVID and the impact it's had on some, we hear about some having mild symptoms, others having more severe. How do the dangers of getting COVID compare to the side effects of a vaccine then?
Yes, I know that is definitely a concern with a lot of people for that. But I think the thing to consider, too, is you don't know if you're going to get that mild versus the severe. With the COVID vaccine, all of those side effects are well known now. People have been getting vaccines since, 2021. So we have a significant amount of data that says that any of those adverse effects are really quite mild compared to people getting either severe COVID or even just mild COVID, again, because of those lingering symptoms of having the actual virus that can happen, especially if you're not vaccinated. That's what we cannot control if you rely on getting the virus itself as your infection versus just the vaccines. And again, because we've already had the vaccines out for a year, those long-term health problems are very, very rare. And the risk of having that happen versus what COVID can do to you is, I would rather take the vaccine than get COVID.
Well, some great information for us, Dr. Wagner. I'm so glad we have you here to break it down for us. Again, everyone, Dr. Jamie Wagner has been our guest, Clinical Associate Professor of Pharmacy Practice at the University of Mississippi School of Pharmacy. You all can get more information about the vaccines by going to vaccines.gov. That's vaccines.gov. And Dr. Wagner, really appreciate this information and looking forward to having you back with us again.
Yes, absolutely. Thank you so much, Cyrus. It was a pleasure being here.
Well, the pleasure is definitely all ours, and we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.